Welcome to The Explainer. Today, we're going to dive right into something called testosterone replacement therapy, or TRT. We'll break down what it is, who it's for, and why one specific form, testosterone cypionate, is one you hear about all the time. You know that feeling, just off? Low energy, maybe your drive just isn't what it used to be, or your mood is all over the place? If any of that sounds familiar, you've probably wondered, hey, what is going on with my hormones? And trust me, you are not the only one asking that question. Okay, so let's get right into it. We have to start at the beginning, right? Before we can even think about solutions, we've got to understand the problem itself. So what does it actually mean to have low T? What does it feel like?
Well, according to the Urology Care Foundation, the signs for what they call testosterone deficiency, or TD, are kind of all over the map. We're talking about a whole spectrum of things, from a lower sex drive and just feeling exhausted all the time, to physical changes like losing muscle mass, dealing with obesity, and even losing body hair.
So what even is testosterone? Simply put, it's the primary male sex hormone. It's made in the testicles, and it is absolutely crucial for a ton of stuff. We're talking everything from sexual development and sex drive to muscle strength and sperm production. So you're experiencing some of those symptoms, but how do you actually get answers? How does a doctor connect those feelings to a real diagnosis? Well, it's not guesswork. There's a very clear process. It's really a three-step dance. First, you talk to your doctor. You lay out all your symptoms and your medical history. Then comes the big one, the blood test. They have to measure your total testosterone level, and they usually need a couple of readings, always done in the morning when your levels are highest. And finally, the diagnosis. It only becomes official when your symptoms and those blood test numbers actually line up. Now, the fancy medical name for this whole condition is hypogonadism, and it basically boils down to one of two problems. Either the factory, the testes, isn't working right, and that's called primary, or the headquarters, your brain, isn't sending out the right production orders. That's called secondary. So it all comes down to a number. And what's the magic number? Well, the clinical threshold is generally considered anything below 300 nanograms per deciliter. So if you've got the symptoms we talked about and your blood test comes back under 300, that's when you're likely looking at a real diagnosis. Okay, diagnosis confirmed. So what's next? That brings us to treatment, and we're going to focus on one of the most common prescriptions out there, testosterone cypionate, and break down exactly what it is and how it works. So what is this stuff? It's basically a lab-made synthetic version of testosterone. It's injectable, and it's suspended in oil. Now, why oil? Think of it like a time-release capsule. That oil makes it absorb into your bloodstream slowly and steadily, which is key for keeping your hormone levels stable without those wild up and down swings. And this chart here really shows you why cypionate is such a popular choice. Just look at the half-life. It's about 8 days long. That's huge. It means you're not having to do injections constantly. Compare that to something like testosterone propionate, which has a half-life of just 2 or 3 days. With that one, you'd be looking at injections far more often. So for convenience, cypionate is often the go-to. But, and this is a really big but, like any medical treatment, TRT is not a silver bullet. It is absolutely essential to look at both sides of the coin. You have to weigh the potential benefits against the potential risks. So let's start with the good stuff. The potential upsides are pretty significant. We're talking about things like an increase in muscle mass and strength, improved libido and sexual function, stronger bones, and even boosts to your mood and cognitive function. These are the kinds of results people are really hoping for. Now, for the flip side, there are some pretty common side effects you need to be aware of. Things like water retention, acne, oily skin, and even mood swings can happen. Another big one is an increase in your red blood cell count, and that's precisely why you can't just do this on your own. You have to be closely monitored by a doctor. And, it can get more serious. The official product information lists some really significant potential risks. We're talking about cardiovascular problems, like a higher risk of heart attack and stroke. And it can also make existing conditions like sleep apnea even worse. There are also concerns around the prostate and even the liver with long-term use. And this is something we absolutely have to talk about. This is a direct quote, an official warning that testosterone is a controlled substance and it can be abused. People might take way, way higher doses than a doctor would ever prescribe, often mixing it with other steroids, and that can lead to severe, sometimes even fatal health issues. So who should definitely stay away from TRT? Well, it's clearly not for everyone. If you have or are even suspected of having prostate or breast cancer, it is a hard no. The same goes for anyone with a history of heart disease, stroke, or blood clots. And it's also not for women, especially if they are pregnant. Okay, so let's say you and your doctor have gone through all of that, the pros, the cons, and you both decide that TRT is the right path. What does that journey actually look like?
First things first, you gotta be patient. This is not an overnight transformation. You might start to feel better, more energy, a better mood within a few weeks, which is great. But the bigger physical changes, like more muscle mass, that's gonna take months to become really noticeable. And all along the way, regular health exams and blood tests are an absolute must.
And this might be one of the most crucial points to really let sink in. TRT is not a one-and-done deal. It's not like taking an antibiotic for a week and you're all better. For most people, this is a long-term commitment that requires continuous supervision from your doctor.
And what happens if you decide to stop? Well, it's not like your body just picks right back up where it left off. See, while you're on TRT, your body's own natural production pretty much shuts down. So if you stop, your levels are going to drop. And those original symptoms you started with, yeah, they're very likely to come right back.
Wow. Okay, that is a lot to think about, isn't it? We've covered the symptoms, the diagnosis, the treatment, the benefits, the pretty significant risks, and the long-term commitment. So, after all that, what's the single most important thing to do next?
It all boils down to this: an informed, open conversation with a qualified healthcare professional. That's it. That is the only way to navigate this complex topic, weigh all the personal pros and cons, and figure out if TRT is a safe and appropriate choice for your specific health situation.